Hey everyone! Welcome back to the channel. Today's topic is an important one. We're talking about ovarian cancer. It's a disease that affects thousands of women around the world every year. But with the right information, early detection, and advancements in treatments, there is hope. In today's video, we're going deep. What ovarian cancer is, how it develops, warning signs, risk factors, treatments, and even how you can support awareness efforts. Alright, let's get started. Ovarian cancer begins in the ovaries, the small organs responsible for producing eggs and hormones like estrogen and progesterone. It happens when cells in the ovary grow uncontrollably, forming a tumor. There are actually more than one type of ovarian cancer. The three main types are epithelial tumors. These start from the cells on the surface of the ovary. They are the most common. Germ cell tumors. These begin in the egg-producing cells. Stromal tumors. These develop in the cells that produce hormones. Each type behaves differently and may need different treatments. One big challenge with ovarian cancer is that it often goes unnoticed in the early stages. Ovarian cancer is described as a silent killer because its early symptoms are often very mild or mistaken for common issues, like bloating, constipation, or fatigue. By the time noticeable symptoms appear, the cancer may have already spread beyond the ovaries. This makes early diagnosis incredibly tough, but not impossible. Here are the most common early signs: persistent bloating, pelvic or abdominal pain, difficulty eating or feeling full quickly, frequent urination. Other symptoms could include fatigue, upset stomach, back pain, pain during intercourse, changes in menstrual cycles. If these symptoms are new, persistent, and occur almost daily for more than a few weeks, it's important to see a doctor. Some women are more at risk than others. Major risk factors include age. Most ovarian cancers develop after menopause. Family history. If your mother, sister, or daughter had ovarian or breast cancer, your risk is higher. Genetic mutations, like BRCA1 and BRCA2 genes. Personal history of breast, uterine, or colon cancer. Endometriosis. Hormone replacement therapy after menopause. However, having one or even several of these risk factors does not mean you will definitely develop ovarian cancer. It just means you should be more vigilant. Diagnosing ovarian cancer usually involves several steps. 1. Pelvic examination. A doctor feels for any masses or irregularities. 2. Imaging tests, like transvaginal ultrasound, CT scans, or MRIs. 3. Blood tests. A test called C125 measures a protein level that may be elevated in ovarian cancer. 4. Biopsy. The most definitive way to diagnose. Involves surgically removing tissue for testing. Remember, no single test is perfect, so doctors often combine several methods. Ovarian cancer is staged from 1 to 4. Stage 1. Cancer is confined to the ovaries. Stage 2. Cancer has spread to the pelvis. Stage 3. Cancer has spread to the abdominal lining or lymph nodes. Stage 4. Cancer has spread to distant organs like the liver or lungs. Early stage diagnosis has a much higher survival rate. Another reason awareness is so important. Treatment depends on the type and stage but usually includes surgery, to remove as much of the tumor as possible. Often includes removing the ovaries, fallopian tubes, and sometimes other tissues. Chemotherapy, drugs that kill cancer cells or stop them from growing. Targeted therapy, drugs that specifically attack cancer cells with minimal harm to normal cells. Radiation therapy, less common but used in specific cases. Newer treatments like immunotherapy and clinical trials are also giving hope to many women. Living with ovarian cancer is challenging, but support is out there. Many survivors talk about the importance of mental health care, joining support groups, and staying informed about their treatment options. For some, life after treatment can mean regular monitoring. For others, it may mean managing ovarian cancer as a chronic illness. Can ovarian cancer be prevented? Not entirely, but you can lower your risk. Oral contraceptives have been shown to lower ovarian cancer risk when taken for several years. A pregnancy and breastfeeding can reduce risk. A prophylactic surgery, removal of the ovaries, is sometimes recommended for high-risk women. And maintaining a healthy weight, not smoking, and regular medical checkups also help. Ovarian cancer is serious, but knowing the risks, recognizing symptoms early, and seeking medical help can make a real difference. If you or someone you love is facing ovarian cancer, remember, you are not alone. Science is making strides every day, and countless organizations exist to offer support and hope. Thank you so much for watching. If you found this video helpful, give it a thumbs up and share it with your friends and family. You might help save a life. And if you haven't yet, don't forget to subscribe for more important health talks. Until next time, take care of yourselves and each other.